life and death situation.
COVID-19 outbreaks continue to take hold of continuing care facilities across the country, leaving family members anxiety-ridden over the idea that their family member may be at risk. But is the risk even greater to take them out and care for them yourself?
It's really more of an ethical consideration. It's a consideration that weighs possibilities and probabilities against eventualities.
And these families didn't get there easily. Joel Ruse works with people who care for those with cognitive impairments. He's become aware of a growing concern in the COVID-19 crisis.
Number of different families with people with different disabilities, physical or developmental or intellectual, are actually quite concerned about loss of support. There's been instances region to region, even funding cuts.
At the Mackenziestown long-term care facility, 21 residents have died due to COVID-19 as of Tuesday. Several more are infected. Starting Thursday, continuing care workers will only work at one facility at a time. Commonly, workers spend time in multiple residences. Revera, the company overseeing the facility, issued a letter to families, advising them to keep residents in the homes, as there can be more risks for those with cognitive impairment outside of them.
People with various forms of dementia or with Alzheimer's who, are unable to retrieve memories about their location or about their address or about their identity. And a small detail like this in someone's diagnosis could lead towards big trouble.
AHS tells City News in part families will need to be prepared to provide care for the resident, which may include additional home supports and be responsible for their care until the facility can safely readmit them. But in a time where people are facing new day-to-day challenges financially and physically, can they handle a responsibility like this?
Canadians are struggling to figure out how to, currently catch up.
The conversation about our country's preparedness for a crisis like this when it comes to care facilities is ramping up.
Is this a reflection that, we have a healthcare system that's set up for working people differently from those who need full-time care?
In Calgary, Taylor Braat, City News.